Hello everyone, and welcome to And Sleep. My name is Tommy Licatese. I have the pleasure of hosting OBGYN Dr. Natasha Fievre. Today we will be discussing fertility and sleep. Welcome to the show, Dr. Fievre.
Thank you so much, Tommy. It's my pleasure to be here.
So for couples who are trying to get pregnant, what are some important things they should know about sleep?
Well, when it comes to achieving a great pregnancy, it's important that we look at the patient as a whole, as well as the partner. And sleep is definitely one factor. Because what happens is that sleeplessness can upset the normal physiological axis, such as the hypothalamic pituitary axis, which then inhibits the gonadotropin axis. So what does that mean?
Took the words out of my mouth. What does this mean?
It means that not sleeping produces certain hormones that actually stop you from producing the hormones you need to get pregnant. Now, in those patients that we've detected those high corticosteroids, which is your stress hormone, it's important for us to look at different causes. And obstructive sleep apnea can also be one of the causes because your body's under a certain amount of stress. So that's why it's very important to screen for obstructive sleep apnea and any sleeping disorders when a patient is trying to conceive.
So tell us more about why it's so important to screen for obstructive sleep apnea.
Well, when you're thinking about achieving a good pregnancy, you want to make sure that the mom is at the ideal health and the perfect candidate. So with obstructive sleep apnea, it results in certain conditions such as decreased oxygenation to the mom, which also passes down to the baby. It can also be associated with different comorbidities like hypertensive disorders. It can be associated with diabetes and also can be a precursor to other underlying conditions.
So if a patient does test positive for obstructive sleep apnea, what are some of the non-invasive treatments that you would recommend?
First and foremost, we talk about diet and exercise. Weight gain does have an effect, be it on your physical well-being, being able to physically rest comfortably and sleep without obstruction, as well as it affects your hormone levels. So those are two things we must address. Now, if you have a patient that we cannot directly address those issues in a timely manner, there are different options. So there's a CPAP, but there is also the oral appliance therapy that can be an option for them.
So can you give us maybe a real life example of a patient that you helped with obstructive sleep apnea in your practice?
So there was a patient of mine, a very sweet patient, who had been trying to get pregnant for about 2 years now. She was now in a very healthy relationship and they definitely wanted to grow their family. Now, she was dealing with a lot of issues with weight gain, and we determined that a lot of her issues were around emotional eating. She noticed that she wasn't sleeping well at night, she was getting up in the middle of the night, that her partner started to complain she was snoring as well. So when we were tackling this issue and I knew I had to send her for sleep studies, I spoke to her about the fact that she would have to lose weight. Now, I always talk about it being a partnership, helping her understand why losing weight was important for her. It was important, number one, in helping her get pregnant. Number two, helping with the obstructive sleep apnea. Because studies have shown that increased weight gain can be one of the factors that leads to such sleep and breathing disorders. I'm happy to say that she was able to get on board with the plan. She went for the sleep studies, got the necessary treatment that she needed, as well as lost that weight, and now she has a toting baby girl.
So is there anything that the partner can do to help make this a more successful journey of fertility?
Absolutely. Now, when we think about sleep disturbances and how that affects fertility, the partner is often the first one to notice that there's something wrong. You're asleep. What do you know what's going on? You know that you're getting up and you're not well rested, but your partner can actually detect if you're snoring at night, which can be suggestive of obstructive sleep apnea. With that information, we can refer them to the proper channels that they can get the care they need for any sleep disturbances, such as using the oral appliance therapy. And with that being said, you're not snoring, it's quieter, your partner's back in the room, and now we'll have that bouncing baby that you so desire.
Well, thank you for coming on to the show.
It was my pleasure. Thank you for having me.
Well, that completes this episode of And Sleep, a Whole You social talk show series with Dr. Fievre. We encourage you to explore the rest of the episodes and visit wholeyou.com to learn more about sleep breathing disorder treatment. The sleep professionals in this video series teamed up with Whole You to spread healthy sleep education across America and were paid for their appearances.